everybody. My name is Juliana Palmer, and today I will be interviewing Dr. Dobbs and Dr. Veilleux, and they can both tell us a little bit more about themselves. So, Dr. Dobbs, would you like to start?
Sure. I'm Paige Dobbs, an assistant professor in the Health, Human Performance, and Recreation Department in the Public Health Program. Actually graduated from the University of Arkansas in 2016.
And Dr. Veilleux?
I am an associate professor in the Department of Psychological Science. This is my 11th year here. I'm a licensed clinical psychologist, and I study distress tolerance, beliefs about emotion, and emotion kind of regulation strategies that people use.
So today we wanted to talk about the collaborative research grant that is available to faculty. And both Dr. Dobbs and Dr. Veilleux used the collaborative research grant for their research on distress intolerance among young adult e-cigarette users. Can you tell me about what got you into conducting the research on this topic?
When I first came to the university, I was really interested in wanting to collaborate and learn from Dr. Veilleux. Dr. Veilleux has done research about distress intolerance among smokers. And I said, hey, I think it's pretty similar with e-cigarette users, but it hasn't been done. And so that was where we started with this project.
Dr. Veilleux, from your perspective, how did you get into this research project with Dr. Dobbs?
As she pointed out, I've done plenty of work with kind of regular smokers, nicotine users, different, people who use regularly, people who use more sporadically, and distress tolerance. And so in my mind, Paige has driven this whole thing, has sort of said, like, here's what I'm interested in, here's stuff that let's see if we can bring these things together.
Could you both tell me a little bit about the project that you guys did using the collaborative research grant?
Yes, so it's an explanatory mixed methods project. So we did this cross-sectional survey, and then after we recruited participants from that survey to take part in interviews. And so we asked them some additional questions, but some of the things is we showed them just preliminary results from the survey and asked them if they could help us understand, what was happening. And we said, we kind of see that there's a whole bunch of people who are using these like disposable devices or using like Juul similar pod-based systems. And then there's fewer people, but there's still people down here who are using like box mods and mock meds. And are these people different? And then we moved into distress intolerance and how they tolerate not being able to, like, abstinence from their e-cigarette. We're now, we've conducted all of the interviews and we're just checking the transcripts. So that's where we kind of are in the process of analyzing some of the quantitative data that we can, getting the qualitative data cleaned so that we can analyze it soon.
What are some key components of having a healthy working relationship between the both of you?
I think there's different ways to have good working relationships, right? And I think Paige has done a really good job as the leader of making sure that the project moves forward, but also that everybody has a voice. Sometimes collaborations are like both people deciding on everything. Sometimes, and I feel like this one has been more of Paige leading, but doing a good job in the leadership role and making sure that like everybody's included, that things are in there. She's talking about it like, she's here to learn from me, but she's really been like the leader here. Mutual appreciation is important, right? I appreciate her leadership. She appreciates the greater longevity that I've had in academia up to this point. And I think because we can appreciate each other, that it makes the collaboration easier. Without Zoom, I don't know that we would have been as successful at maintaining this relationship. And so I just think that having this technology has been crucial to our being able to work together.
Well, I appreciate everything that you guys have shared with me. Is there anything that you guys would like to talk about just in regards to the collaborative research grant or your research?
I really appreciate it. It was something like off the bat that I saw as I think the interdisciplinary focus was something that I really saw as an opportunity. I think it's a really great funding mechanism to help people just get started.